Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Other investigations in endometrial cancer. Pap smear. Pap smear is done in all patients of endometrial cancer. The first investigation done in a patient with postcoital bleeding is pap smear. Second, MRI. MRI is done to know the myometrial involvement or whether the lower uterine segment or cervix are involved or not. CT is done to check the involvement of pelvic area, lymph nodes, and metastasis. The most common route of spread for endometrial cancer is direct spread. Most common site of spread is lungs, that is hematogenous spread. Serous variety. In serous variety of tumor, transperitoneal spread can occur. So during staging, omentectomy should be done. CA 125 levels will be raised in this variety.
thank you and thank you for watching.